All right, here we go. Hello and welcome to Neuro Challenge Foundation for Parkinson's disease. We're so happy that you've joined us today. We are going to hear from BrightStar Care. They are going to present a program called, or a presentation called the Guide Program. It's a new free Medicare dementia program. And before I talk about Lisa, who's going to be our presenter, I just wanted to remind people out there, if you are tuning in and you have Parkinson's disease or you're a care partner for somebody with Parkinson's disease, remember that the statistics do show that a little over 50% of people with Parkinson's disease will at some point develop a form of dementia. And so these kinds of topics that we bring up to you, like the guide program, are very important for you to tune into, because we don't know as this disease progresses what you might be facing. So glad that you're here today. Welcome to Lisa and Doris, who are joining us from BrightStar. If you have questions about this presentation as we are going, please don't hesitate to put those questions into the Q&A bubble, which is at the bottom of your Zoom screen. Type those questions in as soon as they come to your mind. Don't wait until the end. And then Lisa will be able to answer those questions at the end of the presentation. And just to remind you, there are no questions that are too silly or too dumb. So please put them all in there, whatever it is that's on your mind, because Lisa is also a nurse, and so she has a lot of background. I would like to let you all know that this presentation is being recorded, and it will live on our Neuro Challenge YouTube channel when it's all finished. And so you'll be able to review it again and again as needed. Now, without further ado, I'm going to introduce Lisa. Lisa Marie has been a registered nurse for over 30 years. She's dedicated her life to helping those people in need. Her experience includes working in hospitals, nursing homes, urgent care centers, and running the American Red Cross nurse assistant training programs in 3 states. Her true love has always been home care. She feels very privileged to be invited into a client's home and to be trusted to provide care for those people in need. Being a certified dementia practitioner has also allowed her to have advanced knowledge in dementia and be able to build a comprehensive care plan to allow a higher standard of care. She can't imagine a more rewarding career and a way to give back to her community. Lisa, thank you for being here today.
Well, thank you so much for having us. I really appreciate it. And I'm really excited to tell you guys about the guide program. I wanted to start out by talking a little bit about BrightStar first, kind of who we are and a little bit of our background. And then I want to really launch into the guide program, give you as much information as I can. And then at the end, if you do have questions or if you need to go get a hold of us later, absolutely you can do that. But thank you, April, for the introduction. So we are BrightStar Care. We are a national franchise, but my husband and I own 2 franchises that go from South Sarasota all the way down to Punta Gorda. We are, well, we have a lot of awards that I'm going to talk about here in a minute, but I'll go down to the next screen. Hopefully this goes. Won't advance down to the next screen.
Try just clicking on the center of your presentation. There you go.
Got it. Yeah, so locally owned and operated since 2015. So my husband and I have owned the franchises for about 10 years. As April said, I am a registered nurse and a certified dementia practitioner. We are Joint Commission accredited. So for those of you that don't know what Joint Commission is, it's kind of used to have the Good Housekeeping's gold seal of approval. That's kind of what it is in healthcare. So we live by a much higher standard than most. There are only a few Joint Commission accredited home care agencies, private duty, in our area. And it's hard to get accredited, and it's even harder to stay accredited. So it just kind of gives us that gold seal that we're really proud of. And then these are some awards that we've won. These are all from 2025. So we have a company that randomly and anonymously calls all of our clients and all of our caregivers. So we never know who they're calling when, but we were able to obtain the provider of choice, for the client satisfaction scores that we got, as well as the employer choice, because of our caregivers and our nurses being happy with working with us. So with those scores being so high, we were provided the leader in excellence or experience. There's only 2 agencies in Sarasota County and 2 agencies in Charlotte County. We're one of both of those 2 that have obtained that award. So we're really excited and happy, and hope you understand that that's just part of us providing a higher standard of care. And then just some of the services quickly that we provide. We do offer a full scope of services with RN oversight on all of the services. So we do companion care, which is just basic housekeeping, laundry, transportation, personal care services. So we do have caregivers that can provide hands-on care with bathing and dressing. We do have, as I mentioned, skilled nursing. We do send a nurse out to do an assessment on every client, even if they're just getting companion care services. And then every 90 days, we send the nurse back out to do a reassessment. And that's all free of charge. We don't charge for that. It's just part of our oversight. We also help with diabetic management. So people that may need to have blood sugar checks or insulin administered, as well as medication management. So we can help with all of those things. And then we recently incorporated physical therapy as well. So now we do have some physical therapy people on board that can help too. So all of our staff, they are our employees. They're not contractors. So they've all been through the background check. They've been drug tested. They have at least a year of experience, and then they have to go through competency checks. I talked a little bit about our service areas. We do cover Sarasota, Charlotte, DeSoto counties. We are private pay home care, but we do work with the VA, and we also take long-term care insurance. So my husband actually specializes in the insurance part, so he can kind of help with that. We don't have minimums, so we do anything from 1 hour up to 24-hour care. So that's a little bit about us. Now let me tell you about this amazing program. So Medicare came out with this program that they're calling the Guide. It's a pilot program that's going to run for 8 years, and it's free, no cost to the people that qualify. So GUIDE stands for Guiding an Improved Dementia Experience. So what is the GUIDE program? It focuses on comprehensive coordinated care for people with dementia. It's meant to reduce the strain on their unpaid caregivers and help them stay in home. And really the goal is to keep those people with dementia out of the hospital and out of facilities. So they're really looking at, Medicare is looking at trying to get additional resources in the home to keep people from ending up in the hospital or facilities. So this program just started July of 2024. So it's only been inactive, I guess, or active for the last year. It's going to be an 8-year pilot program. So it's going to run for 8 years. And then what they did was CMS put it out to physicians that specialize in dementia that could be part of the approved list of people that can facilitate the program. And then those physicians partner with care providers in the community to administer the care. So BrightStar has been selected. We're really happy as one of the people to be able to do that. We did have to go through background checks. We had to go through very specific training online as well as in person with the physician that's running the program that we're under. So we are ready to go. We have several guide people already, so we're excited about that. A little bit about the guide. I'll go into very specific things, but just kind of a basic rundown of the overview of the guide. So there's some specific qualifications you need to be able to meet the program. And then there's benefits that are included. So they include a comprehensive assessment, an in-home safety assessment. There's monthly care navigation calls, referrals to community resources, and then they are providing $2,563 a year for respite services, which is absolutely amazing. So they'll pay for some care for caregivers if you qualify. So we'll dive in a little bit more about the specific requirements. And this is what we have to start with. So if you think you are interested in the guide program, these are the things that you would have to have. So you'd have to have a dementia Alzheimer's diagnosis from a physician. Medicare Parts A and B. So it has to be traditional Medicare at this point. They're not opening up to Medicare Advantage. So it would have to be the traditional Medicare A and B. And then that person cannot be enrolled in hospice, be with special needs, or the PACE program. And they can't be in a skilled facility. But other than that, if you have a dementia diagnosis, you have Medicare Parts A and B, and you're not in hospice or PACE or in a skilled facility, then potentially qualify for this program. I kind of broke this down a little bit more on each of the things that are included in the program. So the comprehensive assessment is kind of where we start. That's usually with the non-paid caregiver of the person. So it might be a spouse, it might be a family member. But it's a telephonic assessment. So it usually takes about an hour to 2 over the phone, where we interview them, go through a lot of questions about the disease process, how far it's moved along its course, medications, where they are with medications, are they having side effects, any confusions with medications, home safety, things like that. So a lot of information that gives us a good understanding of where they are physically, where they are with their medications, and where they are with safety issues, and then any resources that might be needed. So that's kind of where we start. We turn that into Medicare. It takes usually about 4 to 6 weeks for Medicare to make the final determination that that person is what they call aligned. So then they're able to be accepted into the program. And then from there, we go out, we'll do an in-home safety evaluation. So this is where we're really looking at fall risk hazards. It could be medication issues. Are medications locked? Maybe they need something along the lines of grab bars or door alarms, things like that we have community resources that we can initiate if any of those things are needed. And then from there, it's going to be monthly touch points. So the care navigator would be calling each month to kind of see how things are going. Is there any education that needs to happen? Any additional safety issues that have come up or concerns along the way? But it's just having that contact with that care navigator. And then also that care navigator is made available to them 24/7. So if that person or their caregiver has questions or concerns at any point, they have a direct contact with their care navigator. So, and that just continues on. The respite. So for those who qualify, depending on how the comprehensive assessment comes out, there's 5 tiers. So a couple of those tiers, depending on the severity of the disease and if they have an unpaid caregiver, then they'll qualify for respite. And that's where they get the $2,563 a year to use towards caregivers. So the idea is to bring the caregivers into the client's home to give the unpaid caregiver a break from services. I know this is a ton of information. You'll probably have a lot of questions, but I'll keep going. How we get referrals. So we have information that we hand out to the community that has kind of a basic breakdown of the program. But really, you just need to call us and we'll get the name, the address, the date of birth, the Medicare number, and then the diagnosis code. And then we're able to program that into Medicare's system, and it will tell us if it looks like they qualify for the program. And then that's when we go ahead and schedule the comprehensive assessment over the phone. Okay. That was a ton of information, I know. Do we have any questions?
Let's see. I don't see any in there yet. So again, I'm going to encourage those of you out there listening to this presentation, if you do have questions, Lisa is here to answer today. And I kind of have a question, I think. Well, first of all, amazing benefits that come out of this. I'm really surprised to see like everything packaged together nicely. I love that. And I love this idea of the annual respite. Does that re-up each year, or is it just a one time?
It's every year it's 2,563. That's what it started out at 2,500 and they bumped it up to 2,365, but their calendar year goes from July 1st to June 30th.
Yeah.
Excuse me, and you have to use it within that 1 year period. And then the next year it resets. So you
Wow.
can't, like, if you don't use any the 1 year, you can't roll it to the next year. You have
Hmm.
to use it within that time frame.
Got it. That's
Which
so
is
important to include respite. I'm so glad that they thought of that with this program.
Mhm. Well, and
It-
the resources, just being able to have someone that you can reach out to and ask questions. And,
yeah.
as we know, dementia is a progressive disease. So
Mhm.
things are going to be changing, and that caregiver may have questions or something new happens and they hadn't dealt with it before. So while
Exactly.
they're seeing a behavior or a challenge that they're just not sure how to best handle, or maybe they're getting frustrated and they don't know what to do. So we can refer them to community resources, that may be support groups, things like that, someone else they can talk to that's
Mhm.
going through the same thing that may be helpful. So that's
That,
really why I'm so excited. And the fact that it's a free program with
yeah.
all of these benefits is absolutely amazing.
Yeah, it really makes sense. I like the idea that they have these care calls that they can just sort
Mhm.
of, and I like that they're called navigation care calls. That's so cool because yeah, it's navigating this. It's a completely new diagnosis probably for some of these folks, and they
Yeah.
have no idea what to do next. So this is great. Would you back up one screen? I wanted to see if there was something on. Yeah, so the dementia diagnosis code, how does that fit in for Lewy bodies, which is the most common form of dementia for people with Parkinson's?
Well, as long as they have there's a list of codes that are approved dementia codes for the program.
Hmm.
So, Lewy body dementia, I believe, those codes are in there.
Yeah.
So what we would have to do is just if they're unsure of what their diagnosis code is,
Hmm.
a lot of times after you see a doctor, they give you a printout of
Hmm.
your visit and it will have your diagnosis sometime with the code.
Right.
But the other thing, you just call the doctor's office and say, I need to have the dementia diagnosis code. And those are things we can help them with too. If they give us approval, we can always reach out to the physician and explain what we're needing and why we're needing it. So
Mhm.
we can help with that as well.
Okay, great. Thank you. Just checking on that. So let's go back to the Q&A box. No questions? Oh my goodness. Let's see, people. Do we have any questions for Lisa?
How about how to contact us if they have
That's a
questions?
great idea. Why
I
don't we
didn't
go
put
back?
that in here. Yeah, so we're BrightStar Care, Venison, Port Charlotte. There's actually Bright Stars all around the country. So if you're looking for a BrightStar location, all you have to do is go to brightstar.com, put in the zip code that you live in, and it will automatically tell you what BrightStar covers your territory. And this is obviously, this Medicare program is a national program.
Mhm.
So they should be able to find, no matter where they live, should be able to find a Bright Star and a guide program. So,
Right.
but for us, our phone number is 941-412-4070. And we're
Okay.
Bright Star Care, Venison, Port Charlotte.
Great.
Liz, is there anything that I missed or anything that you wanted to share?
Um, Not on my end. I think you
Okay.
covered everything very, very clearly. I just wanted to know too, is the guide program something that, is it offered to any agency who wants to go through the certification or how does that work?
Well, we were reached out to by the physician, one of the physicians that's running it. He's out of Naples because there's only 330 approved, like physicians around the country.
Ah,
So they opened it up last year and then they did the final round this year.
mhm.
So if someone was wanting to work under that, they'd have to go through one of those approved positions. But they do a pretty intense background check. You have to give them your name, your date of birth, your social security number. They did a really big background on my husband and I for
Yeah,
us to be able to be part of this program.
right,
So
right.
it's not just, I don't think they just let anybody do it. So
Got it. Okay. Wow. It's definitely a great program to look into. So those of you out there who might discover that you have questions later, you can always reach out to Neuro Challenge and we can direct you to BrightStar Care, Doris and Lisa here, and you can get started with finding out if you qualify for this free Medicare program. So Let's see. No other questions coming in, but I want to thank you for your time, Lisa and Doris. And again, this is recorded and will live on our YouTube channel. And we will wish you all a wonderful day. Thank you.
Thank you. Have a good day.
All right. Bye-bye.
Bye.